heart transplant.
In December 1967, Sgt. Pepper was the best-selling album in Britain. The Vietnam War was in full swing. The Arab world was still in a state of shock after the crushing Israeli victory in the Seven-Day War, and de Gaulle had just vetoed British membership of the Common Market. In Cape Town, South Africa, at 3:40 on Saturday afternoon, December the 2nd, the Cape Town Ambulance Service receives an emergency call concerning a road traffic accident outside the Salt River Bakery. Fred Munnick is dispatched from the Pinelands depot. He guns Ambulance 16 onto the highway with its lights flashing, and by the time he's 100 yards down Alexander Road, he's doing 60 miles per hour. We cut to the scene of the accident.
Oh, my God. Oh, dear God. Stop that. You don't look so good. Sit down here. I'll take care of them. Excuse me. Excuse me, please.
Are you okay?
Hey, excuse me. What are you doing? Keith, your mother and Denise, they're over there.
Are you all right? Hey, help me here.
Hold him. He's going to fall.
Let the car keys down. We need the car to take them to the hospital.
It's my wife. Help me.
No, don't, man. Come away. She's badly hurt. You mustn't touch her.
The ambulance will be here. Leave it to them. Let me through. I'm a doctor.
She's bleeding.
Don't touch her.
It's my wife. She doesn't speak. She doesn't say anything anymore. Nothing at all.
Leave her alone. Everyone move back. Move back, please. I said move back, please. You, what's your name?
Darval. Will my wife be all right?
Is the girl over there your daughter?
Yes.
And is that her boyfriend?
That's my son.
You're the son? You better look after your father.
How's my mom?
Please, can you just look after him? Can you all stand back, please? Give the girl some air.
Are you a physician?
Dr. Louis Ehrlich.
Fred Munich. So how does it look?
Well, I only just got here. Let's have a look at the girl.
Right.
She ran out of luck, eh? It looks like the impact tossed the girl over here and she went head first into the hubcap of this parked car. See the dent? If they hadn't been a car parked here, then she might have made it.
But she's still breathing.
There's blood from her mouth, her nose and ears. She was moving her head when I got here.
Right.
Like she's in pain and she knows it. Well, it's obviously a compound fracture of the skull. It's very severe.
So how's the other woman?
Her mother. She's dead.
Oh.
Let's get the girl tidy and into the vehicle. Okay. And then her mum. And I guess the dad too. He doesn't look too good.
Very good.
My mom's dead, right?
Well, I'm afraid so.
What about Denise?
Well, it's serious, but she's alive. Have you got a car?
Yes.
Are you all right to follow? Your dad's going to need you at the hospital.
Of course.
Now, what you need to do...
It is 7 in the evening when Professor Christian Barnard arrives home from the Schulterscure Hospital, where one of his patients, Louis Waszkanski, 54 years old, is on the brink of death. Barnard is 45, an Afrikaner with a glittering medical career behind him. Having trained under Wagenstein in the States, he brought back with him the know-how and the technology to transplant organs. Having rehearsed the procedure on dogs and having performed a kidney transplant, he's determined that the same operation could be performed on the human heart. He had assembled the team. All he is waiting for is the opportunity.
Barnard here.
It's a shame I didn't catch you before you left.
Hello, Kurt.
I think we have a donor.
Who?
A young girl run over by a car. She came into our own emergency department. Stroke of luck, eh?
Oh, not for her. What's her condition?
She has brain damage, and she's O negative.
Is she coloured?
No, why?
Nothing.
Mr. Rosinus is trying to establish irreversible brain damage right now. She's stable on the ventilator.
Check for infections. Take swabs and get them into the lab, and find out how we should go about getting permission. I'm coming right now.
A few minutes later, Dr. Kurt Venter, one of Barnard's closest colleagues on the transplant team, enters the consulting room in which Denise Darval's father is waiting.
When my daughter came in here, she was moaning. I thought you would save her.
I'm sorry.
And just now, there's a tube in her mouth and a man pumping air from a black bag.
Dad, I think we'd better go home.
What home? There's nobody in it. How can you go to a home with nobody in it?
We've done everything we can. We can't do any more. I'm afraid the brain specialists say there's no hope for your daughter.
That's pretty hard to take, Dr. Venter.
I understand. I'd like to talk to you, Mr. Darval. But would it be all right if your son left us alone? Please don't be offended, young man. But it's very important.
All right. I'll be just outside, Dad.
What is it you want to say?
We can't save your daughter because her injuries are too bad. The machines make her breathe and keep her heart going, but Mr. Darval, in reality, your daughter is dead. Now, I can tell you, we have a man in the hospital here who is going to die, but whose life might be saved. He's a nice man. A pretty good man, I think. But you have to give us permission to transplant your daughter's heart and kidney.
I don't know. But then, I don't know what I will do with my daughter either. My wife wanted to be cremated. But Denise, I don't know. I remember a birthday cake she made for me with a heart on it. Daddy, we love you. She bought me a bathrobe with her first week's salary. She was always giving things. So, I think if you could ask her, she would say yes.
Now, the heart is for the man I told you about. The kidney is for a colored boy.
That's fine. Why would I bury it or burn it up into a pile of ashes if I can help someone? That's fine.
I'm going to bring you a form to sign. Then you better go home. You look worn out.
By the time Barnard arrives at the Schulterskuur, it is already dark, and the casualty department is filling up with the usual fallout of a Saturday night of excess. Denise Darval is in room 283 on the second floor, close by to cardiac surgical ward C2.
Hello, Kurt.
Good evening, Chris.
How are things looking?
She's O negative.
So, we could be in business. What's her status?
The ventilator and the electrocardiograph are fine, but there is some fluid on her lungs. We have suction via her ET tube. We have 20 to 30 drops per minute of isoprenaline going into her left arm to stimulate the heart. There's blood going into her right arm to compensate for internal bleeding. Her waist has increased an inch since the accident.
Official time of death?
Rose Innes has gone. He's got an acute patient to deal with. He said there's nothing we can do to save her.
Is that official?
He's coming back later to sign her off.
Why didn't he do it just now?
He's being cautious. He doesn't want anyone saying we rushed the organs out of her. But there's not much doubt about her condition.
What next?
I'm going to cut into the right groin to expose the vein. You said you wanted a route for pressure, samples, transfusions, drugs?
It's a shame her legs are so smashed up. Can't you do something for her before you cut?
We called Ozzy. He's on his way.
Dr. Ozinski, anaesthetist.
I'm not anesthetic. I mean, can't we splint her legs? I don't feel happy just leaving them.
We called the fracture people too.
Then phone again. Hurry them up.
What's the matter, Chris?
We can't stop halfway. As long as she hasn't been pronounced dead, we have to treat her as though she was going to live. Now, call Rose Innes and say we need a final examination. Have we got permission to take the heart?
Yes, and the kidney too.
We need white cell typing and cross-matching with Vashkansky. But she's definitely O negative, right?
Yes.
That's something.
MC has already put the call out to staff up the labs, but it's the weekend and they say they can't do tissue typing in less than 2 hours.
I don't care if it's the weekend. They have to get started right away.
So do you think maybe we better call in the donor and the recipient teams?
Rose Innes still has to give us the go. You better get on the phone. Call them all in.
I'll call them from my office.
Yeah, and put Vashkansky into prep. Poor girl. She was very pretty.
No detectable brain activity.
Mr. Rose Innes, neurologist, returns 20 minutes later.
What do you think?
Same as when I saw her at 5:30 this afternoon, Professor Barnard. They're fixed and dilated. No reaction to painful stimuli. No detectable brain activity. You can see from the x-rays the brain has shifted around to the right. There are bad fractures across the base of both ears. That's where the brain matter has come through. Part of the skull is depressed down into the nose.
So, where does that leave us?
Denise Darvall's brain was dying when we received it, and now every test shows that it is dead.
So, can we go ahead?
Yes, you may go ahead.
Denise Darval of number 2 Marine Flats, Tamberskloof, no longer has any hope of life. Patient number 226070, who once raced over fields, laughed with children, whispered words of love, is now considered medically dead. The death certificate is signed at 11 p.m. Patient Louis Vashkansky.
They're shaving my chest, Doc. Don't tell anyone.
I've just spoken to Professor Schreier. He says the girl's heart is okay, but we can't keep it that way. So, we have to get on with the operation. How do you feel, Louis?
Great! Actually, no. I feel kind of shaky. Like going into the ring when you don't know who you're up against. You're my manager, Doc. What does my enemy look like?
I don't know, Louis.
Oh, he's a Scotland's boy, Doc. The Wild Jack of Spades. He's death, and I guess all you have to fight him with is the King of Hearts. The odds always change at the last minute. Are they moving my way or against me?
Your way.
Tell Anne it's in the bag, eh? So she won't worry.
I spoke to her on the phone. She asked about the odds too. I said we'd try our best. Then she said, "Go ahead, Professor, I'm sitting here." I didn't understand.
It's what she did when I used to box. She just sat at home quietly or outside the hall, no friends around, just sat and waited for me until I was finished.
She's a nice woman.
The best.
And you're a nice man.
Oh, it's just a trick, Doc, to get you on my side.
Well, it looks like it worked. Huh?
I trust you, Doc. Will I see you again before it happens?
Yeah, I'll come see you beforehand, when they put you under. You know, this is the very first time in the whole history of the world.
Don't be scared, Doc. It's really going to happen, right? You're going to cut out both our hearts and put hers in my empty chest? What will you do now? You look so smart, like you're off to play golf.
I'll take a shower. Scrub my arms and hands with antiseptic, put antibiotic ointment in my nose, eye drops to keep them clear, cover my hair and my face, and put on a big gown and clean new rubber gloves and boots.
You'll look a fool.
My brother Marius will be helping to take the girl's heart out.
I hope he's got a steady hand.
Well, I don't think you can expect that from any of us right now. Still, nothing a few stiff whiskies won't take care of. See you in a while, Louis.
Good luck, Doc.
Barnard scrubs up alongside his younger brother Marius, who will assist with extracting the donor's heart.
I'll do the first cutting. Get the donor ready for bypass.
Right.
Then when we're ready, you can excise the heart.
Don't you want to do it?
No.
Why not?
Because it's like all the test operations on the docks. Unless you cut it out yourself, it's not going to be familiar enough. It's better you get acquainted with it from the beginning. How long do you think he'll live with a new heart?
If I said a year, would you think it was worth it?
Yes?
And if it's only a month?
I don't know.
A week?
Certainly not.
But how can we say that? What gives us the right to decide how long a man can live? If I mess this up, then it will have repercussions. Maybe I shouldn't stick my neck out like this.
But someone has to go first. That's an experiment, yes, but not a reckless one.
I just started thinking what it might do to my career.
Pardon?
If I make a fool of myself.
You can't start that. Not now, not here.
All right?
All right.
If we're lucky, then today we're going to enter the history books. I've agreed we'll have open mics in operating theatres A and B. The sound will be piped through to the lecture theatre and a recording will be made. So I'll be talking a lot and stating the obvious, describing what I'm doing. I think that might be useful to all of us, thinking things through, talking them out loud as we go.
First, they will remove Denise Darval's heart, while getting Vashkansky ready to have his heart removed. When they are ready with a new heart, the team will remove the sick man's heart. At this point, it is critical to operate quickly, as the new heart dies. It will need to be kept fresh until it can be brought back to life by having Vashkansky's blood pumping through it. There will be a period of time when Vashkansky has no heart, so the team will connect him to the heart-lung machine.
Over to you, Dr. Wazinski.
Thank you, Professor. After the barbiturate, I injected Mr. Vashkansky with the muscle relaxant Scoli. This paralyzed his muscles, including his lungs. The extra oxygen I gave him before we put him out helped keep him going during the 30 seconds it took me to get the endotracheal tube down Mr. Vashkansky's throat. The black oxygen bag was then hooked up okay, and we pumped the bag 40 times a minute while I put a nasogastric tube into his stomach via the left nostril. It stops him bringing up liquids which could be inhaled into his lungs. I also have 2 thermometer leads going into his mouth and as far as the esophagus, so they end up level with the heart to monitor its temperature. The paralyzing effect of the scoline has now worn off, and I'm continuing to ventilate Mr. Vashkansky with a mixture of oxygen, nitrous oxide, and halothane, which will keep him asleep.
Too late.
Oh, yeah. We stopped pumping the bag by hand, and he's now on the automatic respirator. We have given Mr. Vashkansky an electrical ground to earth, so when we run current through the surgical instruments, the blood vessels will be cauterized as they're cut.
Thank you, Dr. Wazinski. All right, I'm going to have a look at Denise Darval. While I'm away, I'd like Sister Fox-Smith to run a bandage under Louis's waist so we can secure his arms and stop them slipping off the table.
Yes, Professor.
I'd also like a leather strap over his knees to stabilize the body in case we have to tilt the table. Dr. Hitchcock and Sister Jordan will then paint the chest, belly and thighs with iodine to give him the greatest suntan ever. Then we'll cover those areas with Steri-Drain. Then, last thing, we'll drape the body with green toweling so only his chest and right groin are showing. My chief assistant will be Rodney Hewitson.
He's not here.
No, he's always bloody late, but he'll get here soon.
11:45 p.m. 8 hours since the road accident. Operating Theatre B. The donor.
There is a marked deterioration in Miss Darval's condition. At this rate, the heart might fail because of toxins and be too damaged for the transplant.
What's the last potassium reading?
3.4.
Give another gram. And the isoprenaline?
It's running at 20 drops.
Raise it to 30. We need to stimulate the heart more.
Denise Darval will be held artificially in life until Barnard needs her heart. Theoretically, he can take it at any time. There is no reason why it can't be removed while still beating. But Barnard is aware of opinions among the other doctors that such a thing cannot be allowed. He will be cautious.
Christian,
Ja, Marius.
when you have Mr. Waskansky open and ready to go on the heart-lung machine, that's our cue to turn off Miss Darwell's respirator. Are you sure you don't want us to open her up until her heart stops beating, right?
Yes.
And what if her heart just keeps going? What will you do with Waskansky during that time? There's a risk the old man will deteriorate rapidly, making it pointless to carry on.
Of course.
Yeah, that's what I'm asking. If we need to, do you want us to cut while her heart is still beating?
Barnard prays he won't have to make that decision.
No. No. I think we will have to wait until it stops. Then make no mistake, we'll have to move fast. As soon as we have Waskansky open and ready for the heart op, turn off the donor's life support. Once she's dead, I want you to open her, Marius. When you're ready, I'll come back and remove her heart. Right.
Theatre A. Waskansky's heart is still struggling to keep itself alive.
Rodney, how long have you been here?
Traffic, Chris. It's Saturday night and only 3 shopping weeks till Christmas.
Something stinks. How are we doing?
I've made a straight cut down Mr. Waskansky's chest and cauterized the vessels along it. We used an electric saw on the breastbone instead of cutters. It's neater and quicker, but it makes a little smoke. That's the stink. We've waxed the edges to prevent bleeding, and as you can see, I've cranked open the ribcage.
Quick work.
That's what you asked for. Now I'm going to open the pericardial sac now and hold the edges back with stay sutures, thank you. Here we go. God in heaven. Look at it. It's yellow. Oh, the atrium is sliding about like a big fish on a line, like it wants to get away. His heart feels the entire chest cavity from wall to wall. I've never seen anything like it, Chris.
It looks like it's trying to die every time it contracts. Look at the scarring. I can't believe he's still alive. Let's see more of that left ventricle.
Coronary attacks have caused all this muscle death. And one thing is certain, Chris. He'll never leave this table without a transplant.
Let's get him ready for bypass as fast as possible. I'm going to turn off the donor's life support.
Operating Theatre B. Patient Denise Darval. 1:30 a.m. Barnard returns from Waskansky.
Are you ready to switch off Miss Darwell's life support?
Yeah. Do it now. Good. Put the anti-clotting agent into her arm now.
That's it.
Okay, everyone, watch the ECG. The heart will react to the absence of oxygen, which should have come to it in the returning blood. It will automatically start working harder, desperate to find more oxygen. Then it will relax as if it's confused. Then it will start thrashing again, desperate to survive. Then it will lose rhythm as everything gets jumbled up. You will see bursts of activity with lulls in between, until finally it gives up.
And you're certain we shouldn't cut her until the ECG line is flat?
Yeah, we'll wait. Doesn't look like she's going to take long. Theatre A is filling up with spectators. I'm going to get Ozzy to raise the anaesthetist barrier so they wander off back to the lecture theatre. There's too much risk of infection otherwise.
That's it.
What do you say, Chris? Now?
Give it a moment. Let's make sure the heartbeat doesn't come back. All right, Marius, start cutting. Don't bother with cauterizing or tying off vessels. Just get it open.
Barnard prowls between the two theatres. Operating Theatre B. Patient Denise Darval.
What does her heart look like?
Yeah, pretty good. I reckon Washkansky is a lucky man.
It's tiny.
Yeah, you think that because you never get to see it. A healthy one.
So still. All right, Marius. I'll take over. Now, I'm going to cut the vessels as long as possible, so I've got plenty to work with when I have to stitch them to Washkansky.
The heart is more blue than I'd hoped. It didn't beat at all when Marius was opening it.
Let's get Miss Darvel's machine on, sir, so we can flush her little blue heart, eh? Ready, sister?
Ready.
Pump on. Does the catheter in the left ventricle look okay? I don't want to burst it with too much blood. I can't see it from this angle.
That looks great. It's staying in.
Nice pink colour coming back now.
It's fine.
Operating Theatre A. Patient Louis Washkansky. 2 a.m. Mr. Washkansky will be put on bypass as a prelude to removing his diseased heart. Barnard will then return to Theatre B to excise Miss Darval's heart.
All set, Roddy?
Yeah. We're hooked up to pump blood in through the femoral artery in his leg. That way we can get oxygenated blood in and through and out of him without having to go via the heart. All set?
Yes, Mr. Wilson.
All right, Ozzy.
Yes, Professor.
Then switch on Mr. Washkansky's pump. Start cooling his blood in order to slow deterioration. Just in case we need to interrupt his circulation at any time.
The pressure in the line between the machine and the patient is just over 200.
No, it should be half that. What's the pressure in his body?
It's only 20. No, 18. It's dropping, but the line reading is now 240.
Let's have a look.
250. Something is blocked. We're not giving Washkansky all the blood he needs.
At this rate, we'll rupture the line. It's got to be his femoral artery.
Yeah, the artery is very sclerotic. I noticed it when I put in the cannula.
Okay. The artery in his leg is too blocked. It's causing the pressure to back up. So, we're not going to send the blood into him that way. We'll disconnect the tube from the femoral artery and put it directly into the aorta where it leaves the heart.
Line pressure 300.
Cool the blood you're putting through him as fast as you can. We've got to get his temperature down. Suture, I'm going to put a purse string stitch in the wall of the aorta to hold it together.
Okay.
Then I'll stab a hole in the middle for the catheter so we can connect the tube. Now, sister?
Yes.
Please. Clamp the line so I can pull it out of his leg without squirting blood all over the floor.
Yes, Professor.
What the hell?
I did what you said.
Just clamp the line while the pump's still running.
The tubing is ruptured right by the clamp.
Switch it off, quickly!
I'm sorry, Professor.
I thought you'd have realised you needed to switch the damn thing off first. Ozzy, can we cut back the tube to get a clean end?
Of course.
But the air must have got into the tube.
Yes, there's air in it.
Well, can you get the air out?
I can rig something.
No, I tell you what. Take both tubes out of Washkansky right now. Connect them together and run the machine to flush the air through the filters. It's the quickest way. Can we have some towels down before we slip all over Mr. Washkansky's blood?
Yes, Professor.
An agony of minutes as Mr. Washkansky's life hangs by a thread.
Hurry up, Ozzy. Mr. Washkansky can't wait forever.
All right, Chris. All clear.
Right. I'm reconnecting the exit tube and hooking the flow line to the new catheter in the aorta. Okay. Right. Done. I'm removing the clamp. Pump on.
Yes, Professor. Line pressure 100.
Whew. Well done, everyone. That's more like it.
Bad news, though. His heart's going into spasm. The ventricles are fibrillating. This is it, Chris. He's had it. He needs the transplant now.
No wonder. It's half dead. Filled with cold blood and has a great fat tube stuck in the top. Thank God we got him on the machine in the end.
Operating Theatre B. Patient Denise Darval. 2:40 a.m.
We had an accident next door. Oh, we nearly pumped Vashkansky's brain full of air bubbles. So please, everyone, no more surprises, huh?
Right, I've isolated all the major vessels and cleared the surrounding fat. She's all yours, Chris.
Very neat, Morris. You might as well have taken it out.
I was sweating all the way. I can't afford a mistake now. I didn't like the responsibility, Chris. Really, I didn't.
Oh, it looks so small. So neat and perfect. Right, Kurt. Let's turn off the pump.
Sure, Chris.
I'm going to leave the catheters in the heart. Thank you. We'll use them when we flush it in Theatre A. The vent on the left ventricle will be useful if we need an escape for excessive blood and air. Can I have some forceps, please? The bit I'm most nervous about hurting is the sinoatrial nerve. Thank you. Once those nerve cells are damaged, the heart won't know how to hold its rhythm. Here we go. I'm cutting them high, leaving as much as I can. Yes, please. I won't be able to put any of this back again. Denise's aorta is much smaller than Vashkansky's, so I'm going to cut hers obliquely, so we've got a big oval section to stitch to his. Thank you. I can't do that with the pulmonary artery, so I'm going to cut at the bifurcation. Now, I need you to hold the heart up, Marius.
Right, Chris. Like this?
Now, a little higher, so I can get to the 4 pulmonary veins going into the left atrium. Nurse, have you got the bowl of ice surgical saline?
Yes, right here.
Now get in close. I don't want to handle a heart any more than necessary. It's slippery. Heavens. So light. And we'll let the catheters dangle over the edge. Okay. Here goes. If a couple of you could back the doors open, and the rest follow us through. Right, I've counted 31 steps through to Theatre A doors. Ladies and gentlemen, make way for Louis Vashkansky's new heart.
Operating Theatre A. Patient Louis Vashkansky. 3:52 a.m.
He's stable on bypass, Chris.
No. I have to be very careful removing Vashkansky's heart. I'm going to leave behind more artery than I need, because there's no way to put it back again. I'm not going to cut the lesser vessels from Vashkansky's heart. I'm going to take them off below the branch like the lid of a pumpkin. Then I can trim as I go. Damn it!
What is it, Chris?
I've nicked out a piece of the lower ventricle.
What do we do, Chris?
It's all right.
What do you mean?
That's it. The point of no return.
Mr. Vashkansky passed that years ago, Chris.
God in heaven, look at it.
It was a brave old bag of a heart. Now it's dead.
Brought him from Lithuania, halfway around the world. God praise that good old heart. Heavy and out of shape. What a poor old thing it is. Bring a bowl, please, sister.
Professor?
There. Rodney, Suction the cavity and we'll see if we can make the new one fit.
Operating Theatre A.
For the record, Professor Barnard has been trimming and stitching Denise Darwell's heart into Mr. Washkansky's chest. While he's been doing that, we have effectively been managing two independent circulatory systems. We are pumping blood around Mr. Washkansky's body, and so the heart-lung machine is itself effectively occupying the place in his circulatory system where a real heart should be. At the same time, we're putting blood through Miss Darwell's heart, using tubes temporarily sewn into it. When we're ready, we disconnect the new heart from its special tubes, open the clamps, and let the blood going around Mr. Washkansky's body flood into it.
I've matched and stitched the left atrium first, because it looks like it'll be the most difficult to get to later. I've used two needles, stitching one way, then the other at the same time. Okay. Now lower the heart back down, Rod.
It looks lost in that great hole.
Looking at it now, I can see a new problem. It's going to be difficult sewing on the stump of Denise's aorta. The pipes and the clamps that attach the heart-lung machine virtually fill the space around the heart. I don't know if we can get in there to sew properly.
If we get a tear while we're sewing, then it's curtains. This has to be our best stitching, because this is where the most pressure will be once the new heart starts pumping blood.
If we stop the new heart's independent blood flow early, then we could remove the clamp and the catheter tube from its aorta and free up enough room to work properly.
If we do that, we'll have to stitch really fast. We've warmed the new heart. It will be deteriorating all the time.
We can speed things up if you repair the catheter opening in Denise's aorta and I stitch the joint of Washkansky's artery at the same time.
If you say so. Dear God, no pressure, eh?
Can we have the sutures, please?
What's the time?
5:15. The sun will be up.
Okay, Ozzy. Cut the blood flow to the new heart. I think we have to finish within 15 minutes.
The sun climbs. Barnard stitches.
It's 5:34. How are you doing?
Not bad. Just tying off. Done. Phew. Okay. Now we release the clamps, and the blood that previously flushed only Washkansky's body should also flow into Denise's heart as well.
What's that?
What?
I can see from here, look. There are bubbles coming through the stitching line in the pulmonary artery. That means trapped air is being forced through the arteries of the lungs.
Give me a stiletto knife.
Oh, I'll have to put a blade.
Now hurry up! Clamp Denise's aorta again. We don't want the blood in her heart to circulate. Rod, lift the heart so the venting catheter is uppermost. Then release the clamp to let the air out. Suction.
What are you doing?
I'm stabbing a hole in the pulmonary artery and we'll suck the blood until all the air is out. How does it look, Rod?
It looks clear.
All right. Reclamp it. Give me a fine needle. I just need to stitch this hole before we can release the clamp on the aorta and allow the blood to flow through the heart again.
Well done, Chris.
Yeah, well done.
Yeah.
Sorry I shouted at you, Peggy, again.
Don't worry, it's all for Mr. Washkansky.
Yes, it is, indeed. All right, that's done. Take the clamp off and let's see what happens.
Dear God in heaven, I can see it on my screen. Can you see it over there?
It's beginning to spasm.
Now, don't get too excited. Most of the dog hearts did the same thing, but very few of them achieved a regular rhythm. This heart's electrical impulses are all mixed up. We have to shut them down completely first, so then the muscles will have a chance to work together. Ozzy, you ready with the defibrillator?
It's
charged. Sister, would you take the defibrillator round?
Yes, Doctor.
Little more room, please. The paddles, please. All right. In position.
Hope you've got your rubber boots on. Stand clear.
Go ahead. Shock.
Yes, Chris, it's beating.
Give me some readings.
Pressure 90.
And the temperature?
Esophagus 35.4. Rectum 28.1.
Give the isoprenaline to boost the heart rate. Give serum potassium and 10 cc's of calcium. How's it looking, Rod?
No leaks, Chris.
Time?
12 minutes past 6.
Right, Rod. Remove the vent from the left ventricle and close the opening with a purse string suture. Then we're going to stop the pump. The heart will labour under the effort of pumping so much blood, and I expect the rate to drop. Then we'll start the pump again. And we'll repeat this cycle a few times until the heart gets used to its task.
Well, supposing it doesn't want to carry the circulation. That's always been the problem with the dogs.
No, I think it will, Marius. I think it will. I think it just has to get used to being alive again.
Barnard repeats this literally heart-stopping process several times.
Why did you turn it off again? Wasn't that a bit risky? It seemed fine after the second time.
The poor little heart is in training. We're coaching it for the Olympics. But don't worry. I'm not going to do it again. I'm going to pull out the catheter in the aorta and stitch the hole.
The point of no return.
Mr. Washkansky passed that a long time ago. How's he doing, Ozzy?
120 beats a minute. Better than you, I reckon.
Half past 6. I think I want a cup of tea. And a piece of cake, maybe.
I think you should phone the medical superintendent. Tell him what happened.
What shall I say?
That you made a miracle here today? That you changed the world?
I don't think I should say that.
All right, it's true, but all right. Then say, we've just done a heart transplant, and we thought you ought to know we didn't use dogs.
Do we need to tell him his name?
I'd say as little as possible, I think, Christian.
Rodney Hewitson will be fine wiring Mr. Washkansky together. Good. I think you should phone Denise Darville's father.
Of course.
Now it starts, I guess.
What do you mean?
We've given Louis Washkansky a second chance at life. Now we've got to help him hang on to it.